It's amazing how much we're learning about managing conditions like diabetes, right?
Absolutely. And the advancements are happening so quickly.
Yeah, and one thing that's really caught my eye lately is all the buzz around GLP-1 agonists.
Oh,
Not
yeah.
just for diabetes, but now we're hearing about them for weight loss too.
Right.
It's a lot to keep up with.
Yeah, definitely.
So we're going to take a deep dive today into GLP-1 agonists.
Okay.
Try to break it down so that anyone listening can really understand what these medications are all about, how they work, and what, folks need to consider.
Sounds good.
So maybe we can start with the basics, like what exactly are GLP-1 agonists?
Well, to understand GLP-1 agonists, we should probably start with GLP-1 itself.
Okay.
So GLP-1, that stands for glucagon-like peptide 1. It's a naturally occurring hormone that your body produces, and it plays a really crucial role in regulating blood sugar and appetite.
So it's kind of like a key player in our metabolic system.
Exactly.
So what does GLP-1 actually do in the body?
Well, basically, when you eat, GLP-1 tells your pancreas, which is the organ that regulates blood sugar,
Mm.
to release the right amount of insulin.
Okay.
And it also slows down how quickly food empties from your stomach, so it helps you feel fuller for longer.
So it's kind of a two-pronged approach there. It's managing blood sugar and curbing appetite.
Yeah, exactly. It's a pretty incredible hormone.
That's pretty impressive. So where do the GLP-1 agonists fit into all of this?
Well, that's the cool part. These medications, they actually mimic the effects of GLP-1.
Oh,
So they're like giving your body a boost.
so they're not replacing anything. They're just kind of like
They're just-
enhancing what's already there naturally.
Exactly. They're just amplifying the effects of GLP-1.
That makes a lot of sense.
Mm.
Now, I've been hearing all these different names tossed around: Ozempic, Rybelsus, Mounjaro.
Mm.
Are these all GLP-1 agonists?
Yeah, they are. Those are all brand names for different GLP-1 receptor agonists, and each one has a slightly different formulation. Like some of them are injections,
Right.
like Ozempic and Trulicity, while others are taken orally, like Rybelsus.
So it's just different ways of getting that same GLP-1 boost, but they all essentially have the same goal.
Yeah, exactly. They all work by activating the GLP-1 receptors in your body.
Okay.
But it's important to remember that even though they share a similar mechanism, they might be prescribed for different reasons.
Okay, let's talk about that then. Why are these medications prescribed?
Sure, so for type 2 diabetes, where the body isn't using insulin effectively,
Like,
GLP-1 agonists are often recommended when lifestyle changes or maybe first-line medications just haven't been effective enough on their own.
so it's really about finding the right treatment approach for each individual person.
Absolutely. It's not a one-size-fits-all situation.
Right. Okay, that makes sense. Now, what about the weight loss aspect? That seems to be generating a lot of interest.
It is, yeah. And for good reason, the FDA has actually approved specific GLP-1 agonists like semaglutide,
Okay.
which is the medication in Ozempic,
Mhm.
and a higher dose of liraglutide. That's the medication in Saxenda specifically for chronic weight management in adults struggling with obesity.
So it's not even just a side benefit for some of these, it's actually a targeted effect.
Right,
Yeah.
exactly. But it's super important to remember that GLP-1 agonists, even when they're prescribed for weight loss, they're not a magic bullet.
Right.
They work best as part of a comprehensive plan.
Right. Of course.
That includes a healthy diet, regular exercise, and ongoing medical supervision.
So it's not about ditching the healthy habits, it's about adding another tool to the toolbox, so to speak.
Exactly.
Now, with all this talk about the potential benefits, I'm sure some listeners are wondering about potential downsides as well.
Sure.
So let's talk side effects. Are there any concerns people should be aware of?
Yeah, for sure.
Hmm.
Like with any medication, there are potential side effects with GLP-1 agonists.
Right.
But the good news is they're generally considered safe,
Okay.
and most people experience pretty mild side effects, if any at all.
Okay, well, that's reassuring to hear.
Yeah.
What are some of the common ones that people might experience?
The most common ones you'll see are gastrointestinal, so
Mhm.
things like nausea, vomiting, diarrhea, sometimes constipation.
Hmm.
But these usually subside as your body kind of adjusts to the medication.
Okay, so a little bit of temporary discomfort, maybe something that's worth pushing through, considering the potential long-term benefits.
Exactly. It's all about weighing the pros and cons, right?
Right, exactly. But I guess it's important to remember that everyone reacts to medications differently.
Oh, absolutely.
So what might be mild for one person could be really challenging for someone else.
Yeah, for sure.
So I guess that just emphasizes how important it is to have that open communication with your doctor.
Absolutely.
If you're experiencing side effects, don't just try to tough it out. Talk to your doctor. Let's talk about the more serious side effects.
Hmm.
Are there any red flags people should really watch out for?
Yeah, so While rare, there are a few more serious side effects to be aware of.
Okay.
Some people experience a drop in blood sugar hypoglycemia,
Right.
especially if they're taking GLP-1 agonists along with other diabetes medications.
Okay. So it's really important to monitor blood sugar closely when you're first starting on these medications.
Absolutely. And if you have severe abdominal pain vomiting that just doesn't stop, or like a rapid heartbeat,
Hmm.
definitely seek immediate medical attention because those could be signs of pancreatitis,
Mm.
which is a rare but potential side effect.
Okay. Yeah, those are definitely signs not to ignore.
Huh.
So to be clear, while these medications are generally safe, it sounds like that open communication with your doctor throughout that whole process is just absolutely essential.
100%. They can help you manage any side effects and make sure you're really getting the best possible results.
Right. And it really is a partnership, right?
Absolutely.
Your doctor relies on you to share your experiences, and you rely on them for their guidance and support.
Exactly.
It makes me think back to something you mentioned earlier about how GLP-1 agonists are actually being studied for other conditions besides diabetes and obesity.
Yeah.
It's pretty amazing when you think about it. We're talking about a medication that's derived from a naturally occurring hormone,
Right.
and now we're seeing its potential ripple effect across so many different areas of health.
It's incredible, isn't it?
It feels like we're really tapping into something quite profound here.
You said it speaks to how interconnected our bodies are and how scientific discoveries can sometimes lead to these really unexpected applications.
And speaking of unexpected applications, you mentioned research on GLP-1 agonists for conditions like Alzheimer's disease.
Yeah.
That seems like such a huge leap from diabetes and weight loss.
Mm.
Can you tell us a little bit more about that research?
Yeah, absolutely. So it is a relatively new area of research, I'll admit.
Okay.
It's really exciting. Researchers are looking into whether GLP-1 agonists can actually protect brain cells, reduce inflammation, and even improve cognitive function in people with Alzheimer's.
Wow, that's incredible. So it sounds like there's still a lot to learn, but the potential is definitely there.
Oh, absolutely. And there's actually some promising evidence already.
Oh,
One study that was published in The Lancet found that a specific GLP-1 agonist called semaglutide,
okay.
that's the same medication that's in Ozempic,
Hmm.
showed really promising results in slowing cognitive decline in people with early-stage Alzheimer's.
So it's not just theoretical.
Mhm.
There's actually clinical evidence to support these potential benefits.
Yeah.
Are there other areas of research beyond Alzheimer's that you think are worth mentioning?
Yeah, there's a lot of interest right now in using GLP-1 agonists to treat non-alcoholic fatty liver disease,
Oh.
or NAFLD. It's becoming increasingly common and can actually lead to some really serious liver problems down the road.
So it sounds like GLP-1 agonists could potentially address a whole range of metabolic health concerns.
Yeah, they could. And that actually brings us to a really crucial point, the importance of a holistic approach to health.
What do you mean by holistic in this context?
Well, as promising as GLP-1 agonists are, they're not a replacement for a healthy lifestyle.
Right, so it's not an either-or situation. It's about recognizing that they can actually work together.
Exactly. They can work hand in hand. Lifestyle changes can actually increase the effectiveness of medications like GLP-1 agonists. And then, in turn, those medications might make it a bit easier for some people to adopt those healthier habits in the first place.
Right, it's about finding that balance.
Exactly.
Well, with all this talk about the potential of GLP-1 agonists, it really makes you think about the bigger picture. Could this be a turning point in how we approach these really complex chronic conditions like obesity and diabetes?
It's definitely possible. I mean, the success that GLP-1 agonists have shown in clinical trials has really sparked a lot of discussion about their role in addressing these really pressing health challenges that we're facing.
We've tried so many different approaches over the years, and while lifestyle changes are absolutely crucial, they can be incredibly difficult to maintain over the long term.
Yeah.
Could GLP-1 agonists be that extra support that some people need to make those lasting changes?
It's a big question, and it's something that researchers are really actively exploring right now.
Okay.
The fact that these medications work not only on like the metabolism aspect, but also on appetite regulation is huge. That dual action could potentially help people not just lose weight, but keep it off.
Right, which ultimately leads to better health outcomes. It sounds like GLP-1 agonists could be opening up this whole new frontier in how we even understand and treat these conditions.
Absolutely. It's a really rapidly evolving field, and the coming years are probably going to bring even more insights into how we can use these medications.
So for our listeners who are really intrigued by what we've talked about today, what would you say is the most important takeaway for them?
I think the most crucial step is to have a conversation with your doctor.
Okay.
They can look at your individual health history, consider other medications you might be taking, and really determine if a GLP-1 agonist is a suitable treatment option for you.
Your doctor is really your partner in navigating all of this new territory, helping you weigh the benefits and the risks and make those informed decisions about your health. Sounds like it. Well, on that note of informed exploration, we're going to wrap up our deep dive on GLP-1 agonists for today. We hope this episode has given you a clearer understanding of what these medications are, how they work, their potential, and most importantly, we hope it's empowered you to have those informed conversations with your own healthcare providers.
It's been great diving into this topic with you.
As always, until next time, stay curious.